So I actually work in 3 clinical roles here at the Children's. So the 3 jobs I have is as a clinical nurse consultant at the RCH in paediatric oncology. Predominantly that's with the Paediatric Integrated Cancer Service, which is like a statewide kind of quality work. I do a couple of days a week in that, just around quality, and that's where my role in research and things comes in. I do 2 days a week in regional outreach, a shared care program for supportive care of children with cancer and their families. So I'm on the road quite a bit with that. And I still work 1 day a week in outpatient oncology, just in day cancer care, which is kind of that way of bringing it back together. Why we do these things is that real bedside care. So for me personally and professionally, like the work I've been doing in developing optimal pathways has been really understanding how to critique the literature. So if I'm presenting something around the management of a solid tumour, I need to look at the literature, what's statistically significant, what are the good papers out there. And I think understanding research and going away and doing that research has given me good grounding to be able to critique that and bring it back to the healthcare team. The fact that we can have nurses understanding that and actually being able to move forward in quality, bringing that kind of literature to the department, but also trying to foster this kind of culture of inquiry and getting nurses to understand what is important, and that we need to be changing, and that we need to be looking at how we do things all the time. The large part of what I'm doing right now is actually reviewing other people's research. I'm doing a lot of lit reviews around developing some optimal care pathways for paediatric oncology care here in Victoria. So I've been the lead author on that. So it's actually been doing a lot of critiquing of the literature over the last 2 years, and I'm finally getting to the end of that. Probably the last nurse-led project I did in research was looking at telephone triage and advice, and doing a project around looking at what are the most important symptoms we need to kind of develop into a standardised service for triage, and actually giving phone advice to families at home. So that was a multi-site project that went over probably about 6 months as part of a minor thesis. What we're able to do with that is actually get a list of what are the most important symptoms our children experience in the home, and what is the kind of advice we should give for those symptoms. And we already had an international model for that, but it was able to validate it to a local context, that what our consultants and what our experienced clinicians decided would be the most important kind of advice we want. So it was more around validating a currently existing tool overseas. Fortunately, we're able to get some funding to set up a oncology fast track clinic, which is a nurse-led clinic that takes telephone calls from families at home, and then we triage them into our clinic rather than going to the emergency department. So the foundations of that whole process was to develop a local standardised telephone triage guideline. So it was really good to see what is a lot of work for an individual actually make some difference to patients and families.